A child was referred to me when I was a neurosurgeon in Manitoba with multiple intracranial tumors. The child was quite sick, so I brought that child to the operating room in the middle of the night and began to take out her tumors that were in her head. When I went down and looked at her post-op x-ray the following day, I had missed 2 of those tumors, and that necessitated that child returning to the operating room. I think it is that case that triggered the rapid thinking about bringing in that imaging machine into the operating room so that that experience would not recur.
Until recently, the only way for a neurosurgeon to be thoroughly certain of an operation's success was to close the patient and conduct an MRI at a later time. MR imaging during the operation in a sterile environment with the patient still open was not possible until the development of the IMRIS intraoperative MR system, a mobile high-field magnetic resonance system for neurosurgery. A brilliant innovation from Dr. Garnette Sutherland, recipient of the $25,000 award of distinction.
Well, it's a true Canadian success story because it wasn't done by America. I think that as we developed this particular technology and we brought together Canadians with special talents to make it all happen, America took note. Something very fine was done in Canada. The root of this innovation is that we have placed a high-field MRI instrument, in an operating room. You see that instrument with the large bore in it is a magnet. That magnet is a high-field superconducting magnet that allows surgeons, that is, to obtain the images before, during, or after surgery. The other thing you see is an OR table. That is not a normal operating room table. That is a table that can go inside a magnet and not get stuck. When we see surgery, the evolution of surgery, it is all towards smaller openings in the body. Surgeons are accessing through minimalistic channels. It is vital that they are provided instruments in the operating room so they can see around corners, see around the structures that they do not see with their eyes or their microscope. What this innovation does, it bridges the gap between the diagnostic picture and the follow-up picture. The surgeon knows that they've accomplished the goal. The tumor has been removed from the patient's head long before that patient leaves the operating room.
Okay, thanks, Lon.
Yeah.
Good.
At the start of this project, people, notably even those from General Electric, said what has been accomplished here could not be done. We indeed at the time had submitted a grant to our Medical Research Council of Canada to obtain funding. And during the peer review process, many of the people that looked at what we were proposing said, is not possible. And Canadians stayed at the track, developed this technology, put it in the operating room, and have now used it to monitor the progress of surgery in over 540 patients. And we have been able to obtain FDA approval for this instrument, and have now got sales going into the United States of America, notably Harvard, and have sales or a letter of intent for 10 systems into China. We would like to raise the standard of neurosurgery around the world.
Dr. Sutherland's innovation levels the playing field of neurosurgery. Outstanding outcomes will become more commonplace. Corrective surgeries will become fewer, hospital stays shorter. And coming soon, a follow-up innovation will open the door to previously inconceivable procedures.
Well, our next innovative project will be to incorporate robotics into this intraoperative MR system. We have created here in our operating room a digital environment ideal for the introduction of such systems. We are now collaborating with Canada's preeminent robotic company, MD Robotics, to construct an MR-compatible ambidextrous robot that can go down the bore of that magnet and operate within the image that is being acquired. This will allow surgery to progress to a new level of minimal invasiveness, providing surgeons the ability to accurately go where they could not go before and achieve objectives that they could only dream of in the past.